Hello, everyone. My name is Alex Rivera Grant,
I'm Ben Schultz.
and I'm here with Dr. Stephen Hargarten and Deborah Gillespie to talk about their experience with gun violence and safety. Thank you both so much for being here.
A pleasure. Thank you for having me.
Same here.
Before we get started, would you mind just taking a little bit about your background with gun violence and safety?
My name is Steve Hargarten. I'm an emergency physician. I've been practicing in the Milwaukee area on and off for, had been practicing on and off for over 35 years. I stopped seeing patients a couple of years ago, but during my time in the emergency departments of St. Joseph, St. Mary's, and more recently, County and Frederick, I've attended to many gunshot wound victims who've come to the emergency department for care. And so I bring that lived experience, if you will, to this discussion. I've also examined this problem from the standpoint of the public health sciences that I bring to the table, the distribution of these deaths, the age distribution in particular. And I think this conversation is very, very important since the United States has reached a somewhat infamous milestone in that bullets are the leading cause of death from ages 1 to 19. Bullets, not cancer, not viruses, not bacteria, bullets. And I think this is such a timely and important discussion for all of us to have. And thank you for initiating this through this O'Brien Fellowship. More to come, yes.
My name is Deborah Gillespie. I lost my only son and his two friends to gun violence in 2003. And I had the pleasure of meeting Dr. Hargarten some years ago, and I just want to say he's a beautiful person. I consider him to be a medical angel. He doesn't remember this, but I also met him through my sister. She was dying, and she was in Frederick at the time. And he was one of the physicians who tended to her. I just want to say, in both times that he's entered my life, it's just been a true blessing.
Thank you so much, Deborah. It's great to see you again. And really, so you're so dedicated to addressing gun violence from the lived experience, the actual lived experience. So thank you for that. And thank you for your ongoing dedication to addressing this vexing, challenging problem for our community.
Well, thank you both for sharing a little bit about your experiences and for being a little bit vulnerable with us in this moment. We truly do appreciate that. You talked a lot about your different experiences, and I just wanted to get to the victim side of that and your experience with that. If you could talk a little bit about that side of it.
My primary association with or caring for victims is actually relatively short-lived. I see the patient in the emergency department. We make critical decisions very, very rapidly. We are working in concert with surgeons who are also making decisions quickly as to what next to do, going to the operating room or up in the intensive care unit or wherever. My association with or my experience with victims is very, very short limited and compared to other specialties. And I just want to make highlight the fact that Frederick Hospital and Children's both have programs that broaden that victim experience, if you will, with programs that are intentionally dedicated to helping the victim, whether they be a 21-year-old or a 10-year-old, to work through this biomedical injury, a bullet, with the behavioral health injury, with the social care issues that are with the family or with the patient. So that experience with the victim is actually changing in the right direction. Whereas, 20 years ago, when I took care of a gunshot wound victim, I had limited discharge resources for them. I would say you're stable, you're not going to have any ongoing problems with the bullet that's injured you, but I didn't have the resources, didn't have the additional team members, such as a behavioral health psychologist, a social worker, to help that person heal completely, if you will, from this injury. So I think it's a great question to ask Deborah, but to ask others about their experience with patients who are injured by bullets.
as a person who lost somebody to gun violence, but also someone who works with others as well, we'd really love to kind of hear your perspective and what you've kind of seen with your experience.
I've seen an array of responses. Some survivors are very angry that the perpetrator hasn't been caught. Some people are angry and the perpetrator has been caught. I know that it's a huge gap in the family tree. An uncle, an aunt, a sibling, a grandchild, it affects a generation. To not know what that person would have become. So I would say those are the devastating effects of gun violence to a community.
Deborah, as one of the leaders of Mothers Against Gun Violence organization, you have a lot of experience kind of promoting safety. Can you go over some of the work and campaigns that you have done with that and share some of that impact?
I work with Wisconsin Anti-Violent Effort, Moms Demand Action, Million Mom March, and participate in making sure I'm handing out gun locks at events, having events offering gun locks. And I'm proud to say that I work with all three of those organizations and that they're doing very good work.
How have you kind of seen that help the community then when you guys are able to give those gun locks and have those types of events?
Oh yes, people stop. I mean, we have a sign, we put it out that we have free gun locks, and the cars are backing up. People are stopping, grabbing them. Sometimes other people are having events, and I'll ask would they like me to deliver some gun locks. They're gone in no time. I'm just really surprised to see how responsible citizens are when they're given the opportunity to be. That's a really feel good experience to see that they stop and really want them.
Yeah, I know both of you participated in the Milwaukee Black Theater's production of Milwaukee Voices of Gun Violence, Resolute, Resilient, and Revolutionary. What was that kind of start to finish experience like?
For me, it was just a blessing because I collected those stories. And for me, collecting those stories have been helping me heal. And for those individuals to trust me, for Dr. Hargard even allow me to interview him, such an honor. And then to take those stories to Sherry and she say yes. I'm still on floating. And the survivors felt like superstars. I wish you just could have seen them. They felt like superstars that have their stories on stage. And just what a blessing, you know. I just thank God how he has really blessed me and to be able to see their faces when they saw their stories on stage. It's just an unbelievable experience. And I just want to thank Sherry. I'm still thanking Sherry for that.
If I may then add to Deborah's response, I too was very honored to be interviewed. And as I mentioned about my experience with patients who are injured by bullets, my experience is limited. I don't have in my practice a follow-up with patients who've been injured who are literally the lived experience. And participating in this project was helpful for me to recognize the very important role that survivors play, that the lived experience contributes to the important conversation about addressing gun violence. I have been following the public health sciences by looking at the epidemiology of this problem. And I've framed this as a disease that's adversely affecting young Black males. And so I bring my lens of the data, of the numbers, but that only goes so far. And the lived experience, the program that Deborah organized and with the interviews, that's as essential as the numbers are. I can say that it's the leading cause of death in our children and teenagers. And I think the lived experience and the lived experience of moms is critically important to further inform the community leaders about what to do about this. And I think both of them together are very, very positive and very potentially very effective.
Dr. Hargart, you mentioned how you don't get to see them much past after you see them initially. Do you wish that there was a way to follow up, or do you think that would be important for your field?
Well, as an emergency physician, my practice has always been that acute care. And so I, long time ago, recognized that I can't possibly follow up with patients that I've seen in the past for whatever reason. And that's why I think when Deborah approached me, I was so welcoming and honored to be able to chance to participate because I don't have that opportunity. And so emergency physicians are really not the a group, if you will, for that follow-up, but trauma surgeons are, health psychologists are. So the leaders of our Froedtert and our campus comprehensive injury center, Terry DeRune Cassini, she sees these patients over time. Dave Milia sees these patients over time, providing care on an ongoing basis and to help have them work through not only their physical injury, but also their behavioral injury. And I think Deborah mentioning about the anger, frustration, and other emotional behavioral health issues that these patients have, it's so important to work through that with a team that is focused on helping them work through this, helping the parents work through this in a comprehensive way. And I think that's very exciting to see how that works with Project Ujima and Forward for Life and the follow-up clinics now that are have been established for this. And we're seeing this across the country. So it's a good question, but for me, my specialty didn't permit me to follow up with patients, but it has permitted me to count the number of patients. And I think that's where I feel I can make a contribution that complements the leadership that Deborah and others bring to this conversation.
Yeah, and Deborah, I don't know if you had anything that you kind of wanted to add on that front of having the data alongside with those personal stories, because it is so important, like Dr. Hargart was saying, to have both sides, because it really just helps show the real issue from all different sides.
I agree. That's why I thought it was so important to interview Dr. Hargarten. I thought the data made sense to be included. I think in order for us to end gun violence, we do need a logical approach. You know, it just can't be all emotional. To me, gun violence isn't just a Black or brown issue, it's a people issue. And I think Dr. Hargarten brings that point home. That's why it's very important to get these statistics and to be able to show, you know, the facts. I think that's important in order for us to make changes. And I pray this happens. I did reach out to Congresswoman Moore and to Senator Johnson. I'm hoping that we get to do a reading of the play in Madison and in Washington. I think that'd be an awesome opportunity. So you guys keep your fingers crossed.
Would that be the same one that was going on this summer then? Yeah.
Yes, it would be, except for it just be the reading. I saw the reading prior to the full play, and it's very powerfully done. And that way to make it a lot easier to get it done instead of having to bring the whole crew.
What kind of impact do either of you think that that might have to like the greater, because if it's in Madison, the state capitol, it would bring it upon and make it a larger issue for the state. What kind of impact do you think that that might have either with lawmakers or just an emotional appeal as well?
For me, I'm hoping both. You know, and I'm just always very hopeful and prayerful that planting seeds is the key to making change. How big of a ripple, how big of a change it will be, only God knows, but all I can do is just keep trying. that's what keeps me going, just to believe and keep trying.
You
So
make a good point, Deborah, about the seed planting. And I think to your question, Alex, you never know when that seed is going to germinate with someone or with a legislator or with a staff person to start thinking about it in a different way because of these experiences. So I think it's really one that does take steadfast leadership like Deborah has provided and continuing to do that when that critical moment does arise and perhaps there is some advancement of a program, some advancement of a thoughtful policy discussion that leads to real change. So you never know when that's going to happen. And I think it's important for the profession of journalism to be recognizing about paying attention to those opportunities as well in the print media that we have today and still have. So I think it's a really important one that you never know what's going to happen, and you never know except at a critical moment you take advantage of it because that's the critical moment.
In a perfect world, what would it kind of take for us to get to that reality where there's lots of gun safety, we're having less people who are becoming victims of gun violence? What does that look like to you? What changes need to happen to get there?
for me, love. I mean, regardless of who you are, I love you. I treat you as I treat my neighbor as I would want to be treated. There'd be no need for guns or because we'd be able to settle our differences through a conversation over a cup of our favorite drink. We'd be able to have a civil discussion. So that would be the idea community for me.
It's a real good, but yet an important but complicated question. And I think that Deborah just started to make it to what it really needs to be, which is we're all wanting our communities to be healthy and safe for everyone, whether they live in Richland Center or in Cudahy or in Green Bay or Milwaukee. We all want health and safety for our communities, for everyone. And having that as the centerpiece of every discussion helps us perhaps lead towards common ground solutions that we can begin to discuss in a civil, respectful way. And I think we need to really make that an important leap so that we can progress. We can make Milwaukee the healthiest and safest city in the United States. This was in 1929 when Milwaukee was selected as the healthiest city in the United States for a city of its size. And it was reselected in first or second place throughout the 1930s. This categorization stopped during World War II, but it is an important North Star for everyone to work towards. Why not zero tolerance for anyone being injured or killed by bullets? How do we do that together, respectfully together, I think is important. There's no better time to start than now.
Yeah, and I think just even that fact of saying like Milwaukee used to be a city that was top ranked for safety is something that a lot of people, I know I did not know that was something about Milwaukee at all. And I think if people had known that's kind of what used to be, that would definitely, like you said, be the guiding North Star for a lot of people to kind of get back to where we were. And I kind of just wanted to touch on kind of the other perspective as well, because there are people who have guns for different reasons as well. So what kind of a future in a perfect world where everyone is kind of healthy and safe, how does that kind of look for people who maybe have guns for protection or safety? Do you think that kind of translates over as well to your kind of perfect world of safety?
For my perfect world, a gun would be used for hunting, for putting food on the table, sport. Not for, you wouldn't need it for safety in my perfect world.
So it's a really difficult question to answer beyond what Deborah has so nicely stated. But the reality of people wanting a product in the home for self-protection is currently a desire. And from that standpoint, the perfect world would be that these products are secured and stored in a safe manner in the home. And in the event of its need, it would be also retrievable, and the individual is trained to know how to um, operate this product. And so the world of that we live in is complex, and the world that people make decisions are complex, and people decide to have this product in their home. How do they safely secure it so that a child can't find it, a despondent teenager can't find it? And so I think those are elements. I think it's also securing them would reduce the risk of a person wanting to steal the product from the home or from the car. So these are all behavioral issues that need to be firmly and thoughtfully advanced for everyone based on their decision. And then we look at other ways to sort of amplify that. And we have very important discussions about people wearing a seatbelt. And I think that's really important for our community. I think it's really important for our community for people to wear helmets when they ride their motorcycles. Then when do you go towards the more perfect world of saying, we want you to wear that helmet. If you don't, there'll be a ticket, because our community is burdened by head injuries from motorcycle crashes. So these are complex questions that are relatively easy and not so easy to answer. And I really like the way Deborah started out by saying, if everyone was nice to each other, why would we need something other than a product for hunting and sports? But the reality is that that's not the case so far. And we hope that maybe we'll move toward that in the coming decades.
Yeah, and I think that's kind of a great way to kind of look at it for me as well, is just as long as people are being safe. With Deborah, you guys handing out gun locks and people taking them, you really see that there is that kind of accountability with many people who do own this product and who want to have it in their homes. And I think that's, like you both said, one of the most important things is just that safety aspect.
What other things do you kind of have planned for the near future?
Definitely getting all of the stories up, because I'm constantly asked by other survivors whose story I have collected, when is their story going up? So I'm like, okay, I gotta get their stories up. It's a lot of work, trying to find sponsors. So, but that's a part of the excitement of life, right? The challenges of having to finish a product, get the sponsors and get the bus stops up. So, and it's keeping me young. So, it's a good project. Other than that, I'm hoping that we can get the reading, like I said, in Madison and in DC. And even though we didn't get to do that MPS project last year, hopefully we'll get to do that this year, and I'll be giving you a call. And so just basically those three. That's enough to keep me busy, because I do have a husband, and he do expect me to be around him. So that's enough right there.
And with those bus stops, what kind of impact or what kind of reaction do you get from the communities that they're in?
Oh, that's a great question. I've been getting some positive. I know that the survivors go to them on the regular and they're keeping them clean because their loved ones are up. From the media, we got a great response. I was, really surprised at that, but very thankful because these survivors are just, so blessed to see their loved ones, displayed and their stories displayed. I don't do it justice in describing it. I think one of them would even do it, better than me. I haven't even put my own son up there, because I want to finish getting the other survivors up. It's such a great feeling to just see, them just so emotional and excited. I just feel blessed I just feel really blessed for that to have happened for them. It's the best feeling ever.
And Dr. Hargan, the same kind of to you. I know your work is kind of different than Deborah's, but still in your research and in your work, what are kind of the future plans for you? Do you anticipate kind of working with Deborah again, whether it's about the voices of gun violence or what's next for your journey?
Well, I think more of the same, if you will, but also we've been recently working as a group of researchers documenting the numbers way, if you will, about the burden of mental health service requirements of those children who are injured by bullets. And we want to shed light on this by showing that there is an uptick of mental health problems. That's the origin of Project Ujima, and that's the way that I was talking about earlier of comprehensively taking care of patients. I think that's a very major area that many of us are working on to improve, to strengthen the care beyond the immediate wound that's caused by the bullet. And so that's an example of work that I'm doing along with colleagues in pediatric emergency medicine and surgery to help understand this and to document the need so that hospitals don't, that hospitals then see that this is an essential treatment that needs to occur while they're being cared for by the bullet wound. They are being cared for their behavioral challenges and issues, and that social care is initiated as well. And so I think that's a real major opportunity for us to strengthen our treatment while we're also looking at ways to prevent the release of the bullet because the gun is now in the hands of a despondent 17-year-old. We want to secure that gun so they can't use it. And I think that's an important element as well that many of us, again, are working on. So there's a lot of work to be done, and it's not going to happen overnight that we're going to solve this, but we have to continue to nurture leaders like Deborah, because in injury prevention that I've been involved in for many years, it takes, as I said, both the data and the advocates working together and advancing this in a comprehensive way. And so that policy leaders, business leaders, other leaders of civil society start to recognize that we've got to do something more than what we've been doing in the past.
And kind of on to our last kind of point here. Either of you can take this first. And you kind of touched on it, Dr. Hargarden, but just any last pieces of advice or words of wisdom that you have for kind of moving towards the future of advocating for this issue and promoting safety.
If you're an elected official, I would say, who do you need to lose for gun violence to be an issue that you want to address? Who are you willing to lose before you listen? And that gun violence isn't just a Black or brown issue, it is a people issue. And it affects all walk of life. And I pray that we're able to end, for sure, substantially lower gun violence. And I'd like President Biden to consider expanding the definition of mass shootings. Mass shootings, presently as he sees it, it occurs at one time. But urban areas experience mass shootings slowly, sometimes multiple over a weekend, a day, a week. I think since he's talking about offering resources to communities that experience mass shootings, we need to expand that definition.
Again, in this last question, I guess I'll end by the way I started. We've reached a horrific milestone in our country. It's the most common cause of death. Bullets. When I began this work in the early 90s, there was a measles outbreak in the Milwaukee area. And if I have the numbers correctly, there were about 5 deaths from measles in Milwaukee and about 800 cases. During the same time that there were 5 measles cases of children dying from this virus, there were 104 children dying from bullets. The state of Wisconsin responded to the measles epidemic with firm resources, and we battled it, and we don't hear about measles. I think to Deborah's comment about this is not a black, brown, it's a people, it's a family, it's a child issue that we need to get serious about. And we get serious about it with thoughtful people coming to the table and starting to devise thoughtful strategies and put resources. Gun violence for homicide and assault is nested typically in cities, but gun-related suicides is distributed across the entire state,
Yes.
affecting all policymakers' districts. So I think we really have to get serious about this from all sectors, including the journalism professional field, to highlight this in a way that fosters discussion rather than not. And so I think we've got a lot of work to do. And I look to you two, members of this fellowship, for the future of framing this in a way that pulls in people to the discussion rather than not, so that Deborah's vision can be secured in the future.
Once again, I just really want to thank you both for taking the time to be here with us and really applaud you both for the work that you have been doing over the course of however many years for both of you. It's truly so inspiring to see as young people in the world, even as young journalists as well, just to see the passion and heart that you both have for what you do and how much you guys care about your community. And I truly just want to thank you for everything that you do.
Thank you guys for having us and the importance of doing this. Thank you. All
Yeah,
three of you.
for
Thank
the
you.
opportunity.